We are proud to have one of our local partners join us for a kickoff conversation regarding COVID-19 and associated challenges and government responses here in Washington, D.C. and the NCR overall. We are very lucky to have Dr. LaQuandra Nesbitt, Director of the District of Columbia Department of Health, here with us today. Dr. Nesbitt is a board-certified family physician and a published author with more than a decade of experience leading population health initiatives in governmental public health agencies. Appointed by Mayor Bowser in January of 2015 as the Director of the District of Columbia Department of Health in Washington, D.C., Dr. Nesbitt mobilizes organizations and communities to implement innovative solutions that promote health and wellness and achieve health equity. Throughout her career, she has led multi-sector collaborations to address innovation in healthcare delivery and its impact on high cost, high need, and other special populations. The integration of public health and healthcare and the impact of medical marijuana and decriminalization of marijuana possession on the public's health. Prior to her role in DC, Dr. Nesbitt served as the director of the Louisville Metro Department of Public Health and Wellness, where she led initiatives focused on Affordable Care Act, implementation, and violence prevention. Dr. Nesbitt received her Bachelor of Science degree in biochemistry from the University of Michigan, her medical degree from Wayne State University School of Medicine, and a Master of Public Health in Healthcare Management and Policy from the Harvard School of Public Health. She completed an internship in family medicine at the University Hospitals of Cleveland and Case Western Reserve University, and completed the remainder of her family medicine residency in the University of Maryland's Department of Family Medicine, where she served as chief resident. Dr. Nesbitt completed her fellowship training with the Commonwealth Fund Harvard University Fellowship in Minority Health Policy. Before Dr. Nesbitt and I begin our conversation, we hope to leave some time for you to ask questions. Please note that you can submit questions for Dr. Nesbitt by emailing your question to FEMA-JFC@fema.dhs.gov. Good afternoon, Dr. Nesbitt. Thank you again for taking time to talk with us.
Good afternoon, and thanks for having me.
First of all, let me say what a great pleasure it is to have you join us. When I was thinking about how we could kick off this conversation, originally we anticipated you coming to us with a delivered remarks. And we hit on this idea of a conversation that I think is really a great one. So we appreciate you doing that.
Oh, absolutely.
So as we begin here in the National Capital Region, we have such an interdependence and interconnected mutual aid support arrangements that are important to all of us. Our federal partners recognize that we depend upon our local authorities when we step outside of our facilities. Can you provide or advice to our emergency managers that be useful with respect to that cooperation?
Sure. So much of what we do in life that makes us successful is not about what we learn or what we know and how we run our own organizations, but it's the strength of the relationships that we create and the acknowledgement and recognition that so much of our success that we have individually and collectively is about, interdependencies and how successful our relationships are. And a lot of that has to do with effective communication and recognizing that sharing information, drawing on the strengths of our respective organizations only adds to our success. It does not diminish our success. And so a lot of what I have endeavored to do in the various leadership positions that I've had is to acknowledge and to figure out very quickly in any new jurisdiction that I've been in is who my key partners are, how I augment their organizations and strengthen their organizations and vice versa. And so for a complex jurisdiction like Washington, D.C., and a complex region like the National Capital Region, where there's so many, our borders are so porous and our responsibilities and authorities are very fluid, it's extremely important to know what each other is doing at all times and what our strategic plans and strategic visions are at all times, but also what our tactical plans and operations are. And having positive and healthy relationships with each other, not only when we are dealing with complex issues like COVID-19, but even during our day-to-day operations. And so for emergency managers, I would recommend that you not only get to know each other as emergency managers, but you get to know your public health authorities, you get to know your folks in human services, you get to know your folks in economic development, because your success as an emergency manager in a crisis, in a man-made disaster, or in a natural disaster is going to depend on how well you can work with all of those leaders in those different sectors.
That's great advice. I think back to H1N1. That was my first experience in dealing with a pandemic. How well do you think those plans prepared us for this pandemic? Were there any lessons learned that served us well? And were there any that we had left undone that may have slowed our response?
You know, H1N1 was my first pandemic, and I spent my time with H1N1 here in the National Capital Region, playing a number of roles in DC Health, both on the community health side, which is where our immunization program sits, but also serving as an interim medical director in our emergency preparedness program here at DC Health. And that created a tremendous amount of opportunity for me to understand what worked well and what some of our learning opportunities were at the local and regional level. But at the national level, we really took advantage of the ability to understand and to grow from how we needed to quickly ramp up logistics in our country, how we quickly needed to establish some key frameworks that would help us even communicate to the public how pandemics are identified. So even the pandemic response framework that we operate under now in COVID was established as a result of what we learned during H1N1. So there's a lot that we were able to learn from H1N1, not all of it being able to be completely applied in our COVID-19 response, but much of it is. And I would also say that our ability to recognize in this National Capital Region, as we approach our discussions, or as we are intimately involved in discussions about medical countermeasures or the vaccine, we quickly learned that if we establish different priorities for vaccinating our population in Maryland, DC, and Virginia, that would just result in our residents moving across state lines to seek vaccines. And so as much as we could do regional planning for vaccination and communicating to the federal government how important it was to encourage regional planning for vaccination, not only in the National Capital Region, but at the national level, a lot of that was part of our lessons learned for H1N1 as well.
You talked a lot about communication with our partners. So what can you tell us about communicating with the public that might be helpful to emergency managers?
Sure. In times of crisis, there's always the need to balance being transparent, giving individuals the information that they need to take the actions that are necessary for people to take, and giving people the information, the right type of information that doesn't create panic and unnecessary anxiety. And so we have been able to work collaboratively with our partners in emergency management, our partners in the executive office of the mayor, to construct a public dashboard, a website dedicated to coronavirus, and to have our emergency management agency have as much information as we have available to communicate about the current status of affairs in the district. And so I would encourage emergency managers to really be tooled and equipped with the right type of information to focus on a crisis communications approach that really does that balance of giving the public information that gets them to take the necessary actions that the public needs to take, how they need to be moved both to personal action, but also having a sense of their responsibility to the overall community, but also not shifting people into a state of panic that would be dangerous or create an adverse impact on the community.
Great, thanks for that. We know also that during the pandemic, the departments of health have been in the lead. But as emergency managers, we know that building a team is a very important part of our job. Can you tell us anything that you've learned in this experience about building a team and how you've been able to keep that team together for the long haul?
Sure. So, it's impossible for a health director to think about everything that is necessary in a public health response, as massive as a pandemic. And I would say for any emergency that happens in a jurisdiction for which the emergency itself is driven by some subject matter content, whether you're talking about an emergency that's an act of bioterrorism or that's related to cybersecurity or anything where law enforcement may be the subject matter lead or public health may be the subject matter expert lead or your civil engineers because it has to do with the infrastructure, the physical infrastructure of the jurisdiction where they may be the subject matter lead. The way that emergency managers and their planning teams and logistic teams help you to think through the holistic approach and to convene all of the respective agencies and organizations or entities that fall under that emergency services function, right? The NIMS and ICS infrastructure that is so critical to the success of responding to emergencies. Having someone where you're thinking really at the 30,000 foot view, and emergency managers do that as well, but they have members of their team who are going to help you put through, those time plans to say, what are we going to do in the next 24 hours? What are we going to do in the next 72 hours? What are we going to accomplish in the next week? And what are we going to accomplish in the next month, depending on the length of your response? And even when you say, what are we going to accomplish in the next 24 hours, you may even have to break that down in increments of 8 hours. And you may have members of your team who report to you on a day-to-day basis who may need to report into someone in emergency management to help keep those tasks on track. So even in our current infrastructure, our organizational structure, I have a senior member of my team, and I was sharing with someone the other day, I said, yeah, they report in our EOC structure, they report to someone else totally different. I'm not their boss in the EOC, but yes, they do tend to run some ideas by me for input and for brainstorm and for thought leadership. So, emergency managers really are key partners and critical to the success of any major response because they really are our leaders and our experts in how to be very structured in our approach and ensuring that subject matter experts in whatever the topic is aren't missing things and helping to keep us on task.
What aspects of data analytics that you've used in battling the pandemic have been most important to you, and which indicators and information should emergency managers pay the most attention to?
This has been a tough question to answer in in the age of COVID. And the reason why it's sort of a tough question is because public health professionals, in particular our epidemiologists, when they are responding to any outbreak or emerging infectious disease, they really look at a lot of different inputs. They look at a lot of complex data sets. They may do site visits and case investigations. They may build new data sets and key indicators to look at. And then there's also the third sort of rail is the established public health science that tells us how we should act. What has really become part of the national focus and part of a lot of local discussion is the one bucket of local data and key indicators for decision making. And when I say that, those are those types of indicators or metrics about daily case rate and test positivity and hot number of hospitalizations. Those types of metrics are what people have really been sensitized to follow and driven to action around. But in public health, epidemiologists don't only look at that data, they recognize and follow the established public health science and literature, such as case studies, to make decisions. An emergency manager will be well off, will be in a good position to look at the first data elements, such as daily case rates, testing rates in the community, to make sure that those things are always trending in the right direction and making suggestions for action if those trends change. And then communicating very closely with the health department for the other two domains of how epidemiological decisions are made if other interventions are necessary.
I've got one final question for you. And for the audience, we're not going to have time to take questions from you. So if you do have questions that you'd like to get answered, as we said at the onset, we've got an email address, FEMA-JFC@FEMA.dhs.gov, where you can send those. So for the last question, Dr. Nesbitt, can you give us an update on where things currently stand with respect to the virus and with respect to restrictions and reopening of the district, and perhaps what you see in January as we prepare for the inauguration?
Sure. As many of you have probably been prudent observers of the national trends, we've got about, in our update we got from the federal government this week, none of the 64 jurisdictions that they monitor are experiencing a downward trend as of this week. And there is no expectation that any of those states will begin to spontaneously experience a downward trend without intervention. And as we go into deeper into the holiday season in the winter months in many of those states, it is expected that cases will continue to rise as people start to experience more indoor activity and possibly celebrating the winter holidays, winter and fall holidays with their families, participating in more indoor activities and family gatherings where people tend to be less vigilant in their social distancing and mask wearing. If those patterns continue, we will likely be in a position where we continue to see increases of cases in all of the 64 jurisdictions that are monitored, including the District of Columbia. And so while we are what we describe as phase 2 of our phase 3 opening, we have 3 phases, with the phase 3 being the more lenient, which permits more social activities or opportunities for social interaction. But given that we are currently experiencing a consistent and sustained increase in our number of cases that we report daily, our rate of transmission is increasing, and our test positivity rate is increasing in the face of increased testing. The mayor suggested today at a press conference that the district will likely be taking action in the near term to combat these increases. And so what that means for us in terms of January is highly dependent on what happens across the rest of the country. We don't anticipate that we will be isolated from the trends that are happening across the rest of the country. But I always like to remind people that we are humans who exist in this country, and the rates of cases that are happening are a function largely of how humans behave. So we do have the ability to change the trajectory of this virus by washing our hands, wearing a mask, watching our distance, and being judicious about the types of activities that we choose to participate in. And so I would leave people with that thought in mind, is that if we as a region want to be in a different place in January, then we as a region have to be more mindful of the types of activities that we participate in, and the types of social distancing and mask wearing, the levels that we do, even in combination with increased restrictions from any of our elected leadership.
You know, I really think that is great advice for all of us. I think we're all tired. Everybody is, as I listen to them, of the pandemic, but we have to recognize that we still have a long way to go, and we can affect the outcomes by what we do. So Dr. Nesbitt, I want to thank you again for joining us today. We appreciate the leadership that you have brought to battling the pandemic, not only in the District of Columbia, but across the National Capital Region. I think it's reflected in where we've been able to come, and I know your leadership will be important for us as we move forward. So on behalf of the entire Joint Federal Committee, I want to thank you for joining us today.
Thank you. Thanks for having me.